Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help educate you and your families to feel better, function better, and live as many quality, disease-free years as possible. Thanks for joining me this week, and I hope everyone had a blessed week. And we are in part 2 of a very important subject matter, which is pain. Although I think that the weeks that we're going to spend together in pain may enlighten you and provide you with more than just thinking about pain as some single dimensional entity, like I shared with you last time, that everyone during the course of their life will deal with, whether it's physical pain, nutritional pain, or psychological pain. We also talked about where did pain come from. We talked about Genesis, where God told Adam and Eve both with the fall of man that pain would be present in their life. So this subject matter is a very diverse one. It is a multi-billion-dollar business of pain management, how to treat pain. And many times we look at things in medicine, or medicine is looked at, healthcare is looked at very single dimensionally, meaning that if I have elbow pain or wrist pain or shoulder pain, they're looked at as a single entity, the shoulder, the wrist, or the elbow, as opposed to systemically looking at an individual as a whole. So the show, by design, is always about looking at an individual as a whole, and using Luke 1:37, for with God nothing is impossible, as our backdrop. Health literacy is going to provide, hopefully, better awareness of what's around us. And this past week, I've fielded a few emails from you guys about, my position on, let's say, taking on the government. And yeah, I do think there's a lot that can be changed. But I wrote this show not to necessarily change government or point my fingers at fast food restaurants, but to point our finger at the person in the mirror and saying, is my behavior one that is conducive for better health and longevity through God's plan, or is my behavior one that is conducive and leading down man's plan, and man is producing a real host of chronic illness? So now as we talk about pain, let's look at it from the perspective today. Before I get into shows on actual physical pain, shoulder pain, back pain, neck pain, let's go down into a cellular perspective and look at inflammation. And inflammation is the key word, because I know everybody out there listening to me has sprained a body part at some point. We have sprained a wrist, we've sprained our neck, we've sprained an ankle, and we understand the pain associated with a sprain. We understand the swelling that's associated with the sprain. So if we think about a body part that's sprained, we understand that. But most of us don't take the time or have the knowledge to understand cellular inflammation. And our bodies start off as 2 cells in the miracle of life of sperm and egg, and we grow into a big bag of cells, trillions and trillions of cells strong, each individualized, doing a specific function in our body. So we have cells for your liver, we have brain cells, we have bone cells, and they're specialized. And all of them can become inflamed. Now, trauma, physical pain, produces inflammation. But today we're going to talk about cellular inflammation and how cellular inflammation is not only causing Americans to age faster, producing metabolic syndrome. And remember, we just came off shows on metabolic syndrome. So when I speak, I'm going to be connecting a lot of dots. We're not just going to be sticking a Band-Aid on our pain. We're going to be looking at pain, and I'm going to be talking about metabolic syndrome again today. And we're going to talk about aging. So let's dive into this. And I'm going to be using some work today by a gentleman, Barry Sears, Barry Sears, S-E-A-R-S. Now, Dr. Sears is a PhD. He's written a book called Toxic Fat. He's written a bunch of information, including the zone diet. And I'm not a big fan of named dietary plans, but I like Dr. Sears' work because it focuses on inflammation. And I'm going to be doing a show today really focused on nutritional inflammation and how much anti-aging medicine, for instance, is so currently focused on hormonal replacement. I know you guys have probably read about testosterone replacement, estrogen replacement, and especially the hormones that decrease with age. Now, there will be other shows that I do on that, but today we're going to focus more on the fact that relatively little attention is being placed on reducing levels of hormones that increase with aging. So I know we're talking about pain, we're talking about cellular inflammation. We want to talk about hormones that increase, okay, as we age and put more inflammation around the cell. So this is primarily associated with systemic inflammation and elevated levels of insulin. Now, as we came off of metabolic syndrome, we learned that with metabolic syndrome, type 2 diabetes, we're creating more insulin. Hyperinsulinemia means we have too much insulin in our blood. And the primary cause of the rise of these hormones is due to a condition called metabolic syndrome, like we talked about. And that's primarily caused by the diet that we eat. So we're talking about inflammation, we're talking about food, and we're talking about diet. So a more appropriate description of anti-aging medicine would be anti-inflammatory medicine, because the very front line of anti-aging, or to be in the best shape for our life, is to reduce cellular inflammation. Hopefully that's nice and clear. So we want to take a look at cellular inflammation, which produces these nasty things in your body called inflammatory kinases. Now, kinases or cytokines. We're going to stick with cytokines. Now, cytokines are a cellular trigger for inflammation, and we want to reduce the amount of cytokines that are circulating in our bloodstream, because these guys cause the inflammation. So why does this happen? So insulin resistance, for instance, you basically are going through a process in your life that you have no pain. And I know we're talking about pain, and I promise I'm going to get there. But we call this type of inflammation silent inflammation. Dr. Sears, again, does a really good job of isolating what silent inflammation is, because at this point you have no pain. So it's happening for many, many years, if not decades. And it causes your immune system, right, and the organs associated with the immune system to be decreased. So you basically have a impaired immune system while you're dealing with this cellular inflammation. The result is chronic illness like metabolic syndrome. Also, silent inflammation is associated with obesity, type 2 diabetes, heart disease, and hypertension. So all of these conditions coming together, these conditions cluster together to create metabolic syndrome, primarily associated with too much insulin in your blood that accelerate the aging process. Now, all of this could be happening without pain. So as this cellular inflammation is happening for years and decades in your body, you may not have any marker to know that it's happening. But now what I'm going to teach you is what you can do to go and measure what type of cellular inflammation you may have. Talk to your doctors about a blood test called HSCRP. That stands for high sensitivity C-reactive protein. So high sensitive C-reactive protein, HSCRP, it's a crude marker, which means that if you had, let's say, an infection, your HSCRP goes up because there's inflammation in your body, and it may not be telling you the best story, but it is a blood test, and a simple blood test that you should run. But here's what's really, really cool about what we can measure today. A more precise way to measure this silent inflammation is the ratio of two fatty acids. One is called arachidonic acid, AA. Arachidonic acid is highly inflammatory. This comes from omega-6 fatty acids. So omega-6 fatty acids are found in your bad oils, your hydrogenated corn oil, for instance, and your margarine. And this type of oil, this arachidonic acid, causes inflammation. The other is something that is anti-inflammatory, and that's the EPA. Now, EPA is an omega-3 fatty acid. That's found in fish oil, for instance. So we have this omega-6, which causes inflammation, and this omega-3, which is anti-inflammatory. So the ratio of arachidonic acid and EPA in the blood is indicative of inflammatory potential of, it's basically measured for 100 trillion cells in the body. So the higher the arachidonic acid EPA ratio is, the more systemic silent inflammation is taking place in your body, and the faster you're aging. I'm going to get the pain, I promise. Okay, so we're taking a look cellular. We're going down into the core of God's creation, which is the cellular level. And we're looking at this thing as to what's happening at the cellular level to cause inflammation. Now, if we go and measure this, and we measure the arachidonic acid and the EPA in our blood, and even the HSCRP, we could see whether or not our body is under assault. And if we're under assault, we now need to take the steps into taking a look at what we're going to do to reduce those cytokines. How are we going to reduce these cytokines so that we, number one, reduce the inflammation, which then reduces the amount of insulin my body is making? Well, okay, stay with me. And that decreases our probability for type 2 diabetes, heart disease, and hypertension. So there is no drug that can reduce the early stages of silent inflammation. So you can't go to your doctor and say, my arachidonic acid EPA levels are off. What drug do I take? But anti-inflammatory dieting, anti-inflammatory eating is the most effective way to reduce this process. Now, there are some considerations here. For instance, when you look at anti-inflammatory dieting, you have to look at the glycemic load, the glycemic index and the glycemic load. And we talked about this during our metabolic syndrome programs. We want to decrease the intake of grains and starches, and we really want to look at the non-starchy vegetables and fruits. This will substantially reduce the glycemic load, put less stress on our pancreas, and we will secrete less insulin. The second is to take a look at our protein intake and make sure that our protein intake is substantial, because protein stimulates another hormone in your body called glucagon, and glucagon helps maintain stable blood glucose, which is sugar levels. So we want to make sure we're eating healthy protein throughout our day, and we're reducing the glycemic load, okay? Now, the next one we want to look at is we obviously want to decrease the amount of omega-6 fatty acids in our diet. So we start this by reducing vegetable oil and our bad oils. We want to take a look at good oils like olive oil, okay? Or flaxseed oil. These are much healthier oils. The omega-6, remember, drive the arachidonic acid. It drives inflammation, driving cellular inflammation. Supplementation with fish oil is also, I highly recommend that. The only thing is you have to find a high quality fish oil, and feel free to email me if you'd like, and I could point you a couple directions there. So when we look at the type of dietary program we should be eating, we're going to get away from man's food because it's filled with sugar, salt, and omega-6 cheap oils. That's going to increase our cytokines at a cellular level, causing more cellular inflammation, silent inflammation, which can't be measured unless you do the arachidonic acid EPA test in your blood test to see what your levels are like. But what did God give us? He gave us food, and food is medicine. And if you look at food as medicine, you could change and reverse this entire process. We must treat food as if it was a drug, and living an anti-inflammatory lifestyle will drive down and reverse insulin resistance and associated inflammation. And if we do that, here comes the long-winded 17-minute answer: you will have less pain. Yes, let me say that again. As much as we're talking about physical pain, and I'm going to do a host of shows on physical pain, tendon and muscle and ligament and disc and nerve and all of that physical stuff, we have to start by first understanding that inflammation is a driving force for pain. And if we're not eating an anti-inflammatory diet, then we're causing cellular inflammation and we're sticking Band-Aids on the pain. I can't tell you guys the number of patients I've treated. I'm a sports chiropractor that I've treated without ever touching a patient. I just simply change their diet by looking at blood chemistry, evaluating their risk or their risk, I should say, for silent inflammation, or seeing actual macro inflammation on a blood test, and then changing their dietary protocols. Other cultures cook with things like ginger and turmeric and boswellia and ginger and garlic and onion. And these are herbals that are associated with a great decrease of these cytokines. And then by doing that, they act like drugs like Advil or Celebrex. Ginger and turmeric, cheap, inexpensive stuff that you take in a capsule form, could drive down inflammation. God gave us these ingredients because he wanted us to use them in our cooking. Okay, now we don't, in our westernized eating style, don't cook a lot with these types of herbs. But if we're going to really go after cellular inflammation, let's leave today's show by looking at food as medicine, applying food as medicine into our program starting today by cleaning out our cabinets, not buying that man-made food, not shopping at those stores. I don't want the government to shut them down, but I'm just not going to shop there. I'm not going to buy foods that cause cellular inflammation, especially in my children, into my house or into my body. All right, I could go on, but I'm running out of time here. Thank you for listening to the By Design radio program and me, Dr. James Proodian, for this episode. If you'd like more information on me, please go to ProodianHealthcare.com, become a blog subscriber, and please submit any questions for me in this upcoming week for my next show. We're going to continue on pain. Let's really start by changing the way we eat, using God's plan to drive down cellular inflammation and getting rid of all that arachidonic acid. I hope you learned something with me today. God bless and have a great week.